us on the map. Mr. Caruana leading the beat. Australia global rank 6. Feeling the heat like immortality.
All right, so our next syllabus dot point, we are looking at our current and emerging healthcare challenges in Australia. So we'll go through some current ones first. I've got 2 here. I'll rub these off. I'll give you another 2, and then we'll do some emerging ones. So things that are going to happen in the future, or ones that we're already starting to see a bit of a pattern with. So current challenges, all right? The first one being our biggest one, probably our growing and aging population in Australia, okay? Higher demand for aged care and age-related conditions such as dementia, cardiovascular disease, arthritis, is placing significant strain on hospitals and aged care facilities, all right? Because of this challenge, it obviously means that over the, pretty soon amount of time, we need to start incentivizing people to work in aged care. We need to increase the training and the education for people working in aged care. We need to probably dedicate more research and time towards, things like dementia, in hopes of, one, being able to treat it better, but also if people have dementia, be able to help them manage the condition and maybe stay at home as opposed to having to go into a facility and get this ongoing care, all right? So this is definitely one of our biggest ones, and it is only growing, okay, by the year. Second one, we've got chronic illness and disease, okay? So we know from our statistics that while mortality rates from just about everything are going down proportionally to dementia, we do know that due to different advances in medical technologies, that prevalence and incidence rates for most things are actually going up, okay? So prevalence of lifestyle-related diseases, such as, diabetes, obesity, some types of cancers, okay, is increasing. The thing about lifestyle-related diseases is that they are preventable, all right? If you are not someone who is eating a, poor diet all the time, and you're not someone who, drinks heaps of alcohol and doesn't exercise, and basically if you maintain a healthy body weight and you, only go in the sun for the amount of time that you're meant to, and you're having, fruits and vegetables, et cetera, et cetera, et cetera, you shouldn't get these things, okay? But people do, and people are diagnosed with these all the time, every day. And they are preventable. Unfortunately, because they are chronic, so chronic meaning long-term, lifestyle diseases, they do therefore require long-term management. And the management for that is generally quite expensive. So not only regular GP trips or trips to the hospital, but also think about the medication, transporting costs, etc. Blood tests. All right, these people are burdening the healthcare system in Australia when it's completely preventable, which makes it even worse, all right? So there's our first 2. We will go through 2 more. Okay, I know I said I'd do 2 and I did 3. Typical. Third one, equity of access to healthcare in Australia, all right? So ensuring all Australians have equal access to healthcare is still a challenge, all right? It's challenging because of our large, vast nation or continent. Lots of space in Australia, lots of people, but not everyone can access the main central hubs for healthcare, right? But also we have cultural barriers, right? First Nations people still experience significant cultural barriers in accessing culturally sensitive and appropriate healthcare. Number 4, we've got expenditure on prevention versus cure. So, and this is sort of tying to number 5 being sustainability as well. We know that preventative measures, so stopping people from getting disease in the first place, is significantly more cost effective than actually treating the sick people, okay? You can run a campaign that may stop, X amount of 1 million people, getting skin cancer, okay? To treat those same 1 million people for skin cancer is significantly more money, all right? And the money's got to come from taxpayers most of the time through Medicare, all right? So there's always the constant argument about shifting expenditure from curative treatments to preventable measures, but then that leaves the current population with the current disease and illness without the care that they need to get fixed. So, like I said, you can't just leave the current people to, be sick and then fix everyone else in 20, 30 years' time who won't get sick. It's a balancing act, and as I've said in a previous video, I would not want to be the person in charge of making that decision. Finally, sustainability. So we know that there is a rising cost of the healthcare system, so things like medical technology, the growing and aging population requiring 24/7 care most of the time, and more facilities, more infrastructure, okay, pharmaceuticals, and obviously workforce to staff the facilities and the new infrastructure and all that. It all costs money, okay? And the current amount of expenditure that that the government is sort of setting aside for healthcare in Australia is not sustainable, okay? So at the moment, we're making the government is doing their best to suit everyone's healthcare needs. But if we keep projecting that same expenditure into the future, then taxes are going to have to go significantly up for all Australians to cover the cost of Medicare and healthcare here in Australia, or at least keeping it, as public as possible. All right. So obviously solutions to that one is going to be, well, the easiest one would be to stop people getting sick and stop people needing care, but that's probably not going to happen. So you could look at like other models that the other countries do, like, mandating private health insurance and things like that, or, increasing taxes for healthcare. I don't know. It's a tricky one, all right? But sustainability is definitely a current challenge for our healthcare system in Australia. Okay, rub this off and then we'll go through some emerging challenges or future challenges. Okay, so some emerging challenges in the healthcare system, and not all these things are bad. Some are good. Or, most things in life, there's a good aspect, but there's also a bad aspect to it. So the changing role of the hospital, okay? Traditionally, you go to the hospital when you're sick, you go into a bed. Once you're in the bed, they diagnose you, they then treat you, or they put you in surgery, or blah, 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 blah. And then you leave hospital when you're better. Okay, that's how the hospital system used to work 10 years ago. It doesn't work that way anymore. There are no beds. You can't just go and lay in a bed. You don't rock up, to ED in the middle of the night and they put you in a nice little bed with a little cup of tea and, a little packet of biscuits until the doctor can see you. There's none of that going on, okay? Hospitals are overcrowded and they are flooded with people, okay? And all these people have a whole range of different issues, okay? And despite everyone's first go-to solution, you can't just build more hospitals. It just doesn't work that way. Although more hospitals would help, but that's money. And then that goes back to the initial slide, or the previous screen where we were talking about sustainability. So to counteract this, more patients are now being diagnosed and treated in the community or in the home, okay? Through programs like Hospital in the Home, all right, which is very successfully run down in Victoria. And so these types of programs deliver traditional hospital type services, such as transfusions or medications or physiotherapy and stuff, but in the home, so not actually in the hospital. So you actually have a qualified person, GP, nurse, etc., come to you and able to, put an IV drip in and let that sit there for 6 hours, as opposed to you having to go to the hospital, sit in a bed for 6 hours with an IV drip in, all right? So these types of things reduce the burden on the hospital system, which is great, which allows the hospital to then focus on specialised complex care and acute emergencies like the surgeries and like treating things that you need massive medical technologies like cancers, etc. for, okay? So this is a good thing, all right? It's a challenge because more people need to be able to access hospital at home type programs, but it can also have massive benefits. The second one is the privatisation of healthcare, or the private sector. We know that there are increasing private facilities in Australia, and they're always being built, especially aged care is a massive one at the moment. There's private aged care facilities popping up everywhere, okay? I think there's 3 currently being built in a 5-kilometre radius of this school. And that's a good thing to a degree, okay? So at least a greater efficiency in healthcare, so people are able to get, diagnosed, seen, treated, and dealt with faster, all right? And therefore, because more people are getting dealt with through in the private system, it does reduce the burden on the public system, okay? So therefore, more people can then go to the hospital. But the caveat is that it also adds to the argument of the equity of access that we went through on the previous screen. Because not everyone can afford private health insurance and therefore get private care. So not only do you have to pay for private health insurance, you've then got to pay for actually getting the care itself, and that's more out-of-pocket expenses. And not everyone in Australia, the way that we've set up Medicare, not everyone should be expected to access private healthcare, all right? Just because I can go to Lake Mac Private Hospital and get pretty much seen instantly instead of waiting at John Hunter Hospital ED for 3 or 4 hours, doesn't mean it doesn't cost me money. I've still got to pay my yearly private health insurance, and then I've got to pay the $500 to be seen. You know, so it's just more out-of-pocket expenses. So privatization, very good for the healthcare system, not so good for the community that can't afford it. But if you can afford it, should access it, all right? Which is why we have the Medicare levy, all right? So you need to have private health insurance if you earn over a certain income, but maybe the government should be like increasing that, as in like not increasing the amount of income you need to have to get private health insurance, maybe increase the incentive for people to have private health insurance. I don't know. Or maybe make the levy larger if you're not. That's probably a good solution, because at the moment it's only like, 1.5 or 2%. Increase it to like 10%, and then like people who can afford it will get private health insurance. Finally, the use of AI. The use of AI in healthcare is certainly an emerging space. It was funny, right? I use AI a lot in my daily life, just asking it random questions. I guess, and to a degree, AI is sort of like a search engine, but I don't know. I sort of like the interactions, okay? I like being able to have sort of a discussion around topics, and I get greater understanding as opposed to just typing something into a Google search and getting like websites. I like the personalized responses. So this is emerging, as we know, because if I think back to like 2 years ago, yes, AI was a thing 2 years ago, but no one was really using it. And if you were using it, you were like, at the top end of things. Like I look at where my life was 2 years ago, and I certainly wasn't using AI, whereas these days I will access AI daily, even on the weekends. I'm mainly using it in my private life. So yeah, it is, and it's still in like its baby phase, right? It's only going to get bigger and greater, hopefully, touch wood, except for when, the robots take over the world. But that's a joke, it's not really going to happen, except if you believe all those movies. Anyway, where was I going with this point? The use of AI in healthcare, right? So people in the healthcare profession are also greatly using AI, okay? It is improving efficiency in diagnosis, all right? So people are able to get diagnoses faster through the use of AI. I do believe this is actually going to get to a point where you're actually able to probably log on to some sort of website. It'd be government regulated, hopefully, and people could literally, type in or tick boxes as to the symptoms and what they've been feeling and how long it's been going for. And then the AI system magically would generate them a script to go to the chemist and get the medication that they need. And obviously if the medication they need doesn't, fix them in 5 days or so, then they probably need to go back to a doctor, or they then get referred to a real life doctor, a real person. I'm a real boy. That type of stuff. So that would be cool. And hopefully that system would be linked up to, remember we're trying to move to having all of our health records in one central database. So hopefully the AI system is going to be linked to that, so that when it starts diagnosing you for the thing that you've typed into the system that you've got issues with, it will then also know your health record and be like, oh yeah, you can have this medication because it doesn't interact with any of your allergies or your food intolerances, whatever is going on in your life. So I think that's where we're going to get to with AI in healthcare. And I would go out on a limb and say, I don't think that's too far away, to be fair. 5-10 years maybe, if that. The other good thing about AI is that if it does have access to all of your health records, it can then create, personalized or bespoke healthcare plans, okay? So I don't get a generic cookie cutter printout from the doctor that says, this is what you should do with your asthma or whatever. I get one that's actually tailored for me and all of the things that go on in my life, and the hours I work and the kids that I have to look after and what I eat in my diet. Like AI has a lot of I was going to say benefits, but positives, okay? Because it can analyze all these different aspects of data in your life and then spit you out exactly what you need, all right? It's also streamlining administration tasks for people that do work in the healthcare system. So hopefully they're spending less time doing actual busy work and more time actually treating patients, you know? It's funny, I say that because as a teacher, and you've probably all seen it in the news over the last few years, like so much of my day are these administrative tasks, which have really, at the end of the day, nothing to do with me teaching a class, okay? But I've got to do them, and they're only getting bigger and bigger. And despite the fact that we do have AI, at this point, it's not at a point where I can just like delegate AI to answer all my emails for me. That would be great. You know, I spend at least an hour or two every day on emails. Imagine that, just AI answering all my emails. However, once again, double-edged sword, it does raise ethical concerns around data privacy. So imagine if like you had this whole database with all of your health records in it and all of your interactions with AI, and then it just got leaked, okay? There would be people freaking out about that. I personally wouldn't care, okay? I don't care whether people know about my life and what's going on medically, but I know some other people are like, you know, tin hat, that kind of stuff. But the other thing that AI misses, and it's not there, and I don't actually know if it will ever get there, okay? It's a big call, but you know, like I said, we are in the infancy of AI. The lack of the human element, the lack of human judgment, okay? Because sometimes people are sick and you can put the data in and the data can say, okay, well, it's either X condition, Y condition, or Z condition. But unless you actually talk to the person and understand what they're going through, it could be something completely different that is not really related, but you wouldn't understand that unless you are talking with that person and you understand everything about them that's going on, and not just looking at data, not just looking at like a blood pressure reading or, you know, levels of vitamin XYZ in the bloodstream or, you know, previous surgery and stuff. You need to understand people to then diagnose people and give them the best healthcare plan that they need for their life. And AI doesn't have that yet. Remember, growth mindset. So they are three emerging challenges of the healthcare system. And that will end our video looking at current and emerging healthcare challenges. Thanks.